Hello, world. Let's get.
We're teaching them about free. You can come there and learn about money market.
Thank you for saying this and fun meeting you. Planning and
But with these skills, if you are learning yourself,
touch with the ceramic.
Hello, world. Welcome to Africa. Let's talk. My name is Kofi Oppong. Today, we are actually delving into the heart of health and wellness. Our discussion today is geared towards the upcoming fifth annual Health and Wellness Fair by the Sierra Leone Nurses Association of Minnesota. Please join us wherever you are as we explore the missions and values driving this amazing organization in the community, as well as the diverse communities that they serve. We will also be looking at the array of impactful programs that they offer, especially the highly anticipated Health and Wellness Fair. My guests today are Madam Kumba Kanu. She is the president of the association. I also have Sheku Sheriff. He is the vice president, as well as Hussanatu Kamara. She is the general secretary. And we also have Nancy Bangaru, and will be joined shortly by Hassan Kamara, the treasurer of the organization. Ladies and gentlemen, please, you are welcome to the program.
Thank you.
Thank you.
Absolutely. So
Thank
please,
you.
if you also joined us, this, like I mentioned, this African Let's Talk, we are having an amazing conversation towards the annual Health and Wellness Fair. We did this last year. We are doing it again this year. So please, wherever you are, share the video, invite your friends as we delve into this program. Of course, we would like to begin the conversation with you, Madam President. Can you run us through what last year was like and what stood out? And what is the general preparation towards this year's fair?
Yes, thank you so much, Mr. Beyond. Thank you for having us. And to all the audience, thank you for tuning in. So, Sierra Leone Nurses Association, as you know, we're working all year round. We're doing vaccines, we're doing health fairs. We have a signature program, which is our senior program. And every year, towards our independence, we have this big get together that we do before the big celebration. This coming Friday, May 3rd, we're going to have our annual health fair. And on Saturday, we'll have the independence celebration after that. So last year, if I can take you back, was a really grand celebration at Crystal Community Center. We had over 150 people come in. We had various vendors, over 20 vendors that were there. We talked about insurances. We talked about clothing. We talked about parent-child care. We also talked about diseases that our nurses put together, like diabetes, asthma, COPD, to educate the community about those chronic conditions. We also had mental health, and I also shouldn't forget, we had 2 stores that came in that were selling clothing. If you're going to the Sierra Leone Independence this year and you don't have any clothes, please come on Friday. There will be plenty of African attires that you can look through. But anyway, it's like I said, it was a big celebration. It's just a fun get together for the whole family.
Indeed, I just popped up some images from last year. So in case anybody missed what happened last year, these were some of the images that actually took place last year. We just ran it through some of them. Thank you so very much, Madam President, for actually delving into what happened last year as we look towards what is going on in this year. Of course, my next question is, and I believe that the secretary can help us with this. We would like to learn for people who may not be very familiar with the association. We'd like to learn about the organization's mission and values. Please, can you provide some insights into the mission and values, please?
Yes, Mr. Beyond. This is Hussanatu, excuse me, Kamara, and I'm the executive secretary for Sierra Leone Nurses Association. The Sierra Leone Nurses Association focuses more on health and wellness for our community. We strive to ensure that we educate the community about the diseases that are common especially in the African American community, hypertension, kidney disease, diabetes, one of the most rampant conditions in the community. Our goal is not only to educate, but also we want to ensure that our seniors are not in social isolation at home. They can come to our senior program. We are very, very proud of one of the senior program that we developed in the past couple of years. In fact, on Friday, on Saturday, we had a grand celebration with the senior community, and in honoring them since we are celebrating 63rd Independence celebration, we thought it would be a privilege for us and a thank you for us to honor our seniors as well. I believe, in a nutshell, I would say that's one of our focus. So the senior outreach program is one of the one of our programs that we are really proud of.
All right. Thank you so very much for sharing what the organization does in terms of its mission and as well as its vision. Indeed, your senior program is one that I admire very much. I've been into several communities and I realized that how you bring the seniors together in the Sierra Leone community is highly, highly admirable. So thank you for sharing and, of course, for throwing light on that. The next thing I would like to know, of course, in the meantime, let me actually pick these few comments coming in. Raggy Bar says, I'm looking forward to the health and wellness fair. I attended a couple years ago. I loved it. Indeed. Thank you so very much for your comments. Keep your comments coming in, and we are more than willing to talk about them, of course, to mention them right here on the program. Emilia O. Smith says, watching and cheering you all, our Kumba SLNA leadership. Indeed. Thank you so very much. Keep your comments coming in. The next thing I would like to find out as far as the organization is concerned, you mentioned about the senior group and there's other services that you do. Please, Mr. Vice President, are there any other areas which the organization primarily serve that has not been mentioned already?
Yes, over the years, every year we do organize vaccine immunization drives in which we give free flu shots to members of our community. And we usually work in collaboration with Fairview and Coop Foods. And also over the COVID pandemic, we were also able to work with organizations that were giving the vaccine to make sure that our relatives, one, understood that the vaccines were safe, and dispel some of the myths and encourage them to take the vaccine, and also provide access to the vaccine by actually bringing the vaccine to our people. And also we have taken opportunities because we all come from Africa and we have the healthcare challenges in Africa. So we have organized certain equipment drives, which we send to healthcare organizations back home. Last time, one of our members, Mr. Daniel Kenewa, went to Sierra Leone and he made supplies of health equipment, essential health equipment to hospitals over there. We are also collaborating in building a clinic. We have sponsored the building of another clinic. And also we have collaborated in helping the biggest maternal healthcare organization in the provinces in Sierra Leone, which is the Rural Healthcare Initiative. We also gave them some sponsorship. So we are doing a lot. And also back here, we're not only concerned with the seniors. We have youths in our community who are facing a lot of challenges, especially during the COVID. They were at home, and also just the way we are in this community. Sometimes there's a lot of violence. Sometimes there's a lot of traumatic things that affect our kids. So we sometimes provide opportunities for healthcare organizations or professionals in mental health to come and talk to our youths to just guide them through the challenges. So we have a lot of programs, of course.
All right, indeed. Thank you so very much, Mr. Vice President, for speaking to the programs that the Sierra Leone Nurses Association of Minnesota offers. Of course, at this point, we'd like to delve into the overview. No, actually, what probably we'll talk about now is about background information. And I know this has been going on. This is the 5th year of the fair. So we'd like to know an overview of the background information about this fair. I think Madam President and then Nancy, please. Any of you can speak, and then if there's any follow-up, please.
Thank you. So in 2017, SLNA was formed and officially launched in 2018. The reason why we decided to form SLNA, Sierra Leone Nurses Association in Minnesota, is to have an organizing body. Our community have a lot of nurses, and we didn't have one body with a voice that we can all come with to help the community. So we decided to come up, and form this organization. The first year we had a small health fair. We had that. In 2018, we had another health fair in 2019. And then COVID came. 2020, 2021, and 2022, we didn't do any health fair because of the COVID at that time. But then we started again last year in 2023. So the goal for our health fair is to actually bring resources to our community. And not only healthcare, but bring in resources like financial resources, bring in, of course, health, everything that can improve wellness and and well-being. We try to bring that. We try to collaborate with community partners. For example, one of our vendors and sponsors that's going to be coming this year is the Council for Minnesotans of African Heritage, and that's CIMA. And actually, it's a task force that was created in the Minnesota department so they can help Africans like us, so we can be able to know the policies and procedures of the state of Minnesota. So they're going to be coming and they'll be talking to participants during the health fair about some of the initiatives that they have. And we also have Global Fatherhood Foundation. It's a group that in Minnesota, they've been actively working to help fathers be able to function well in society, and also helping some fathers that have been just coming from being incarcerated from jail. They're helping them finding a place for them in our community. And one of the other new vendors that we have this year as well is breast cancer. Breast cancer awareness. We're going to have breast cancer champions of Minnesota that will be coming in to share information about breast cancer. I'll have Nancy pick it up and then go ahead from there.
All right, Nancy. So as it is there any other information? Please, if you can unmute. Oh, okay. I think yes. Okay, perfect, Nancy. So please, is there any other more information that you may add as far as the background information about the health and wellness fair is concerned? No, I think you are muted. Let me. Hello, Nancy. Yes, can you unmute? Yes.
Can you
Yes.
hear me now?
Yes, we can hear
Yes,
you.
we can now.
Like everybody else have mentioned, the goal of the health fair is to get the community together. The more and the better you know, the better you're going to do. We aim to educate people on different disease processes, preventative measures. There's so many opportunities to meet different organizations and learn of the services that they offer, and also an opportunity to learn of SLNA. And I just want to take this time to say that, just like our vice chairman has said, SLNA offers a lot. It's beyond the senior program. It's beyond the vaccine. We aim to do far more. So I'm taking this time to also appeal to all our health professionals that are out there in the communities. You do this job every day. You educate every day. You advocate every day. You treat every day. You care for people every day. Bring that to a community. Serve the people that is your neighbors and your family members. Bring it home. So we look forward to see all of us, the whole community at the fair. Lots to offer, lots to learn. And this year we're trying to educate and do education on simple different diseases that affect each and every one of us every day. So there'll be different things to be educated on every hour at the fair this year. So that's new and that's something exciting.
Indeed, something exciting is upcoming, especially towards this health and wellness fair that is coming up. I believe the date is this Friday, so we'll be getting more information about the time, the venue, and everything. Mr. Hassan, would like to hear from you. Indeed, if you can touch on the target audience that this health and resource fair is seeking to reach. Is it open to the entire community? Who are the people that we're seeking to target for this health and wellness fair?
Thank you very much. We are targeting the community, even though the name Sierra Leone National Association, Doses Association, we target other nationals, Liberian community, Cameroonians, Senegalese, Gambians, etc. In fact, we have what we call West Africa Collaborative in Minnesota that comprises Sierra Leone, Gambia, Nigeria, Cameroon, Ghana, etc. So we are targeting a large audience, including youths, the elderly, the senior, as you can name any one of them. The resources we hope to bring to this community is the vendors that come to this gathering always donate towards the cause. There are some vendors that do not come, but they still donate towards the cause. You have like Cobb Food, West Fargo, Target, and the hospitals around like Fairview, Mercy, or HCMC. And then the Sierra Leone community itself has an umbrella organization. We have Sierra Leone community in Minnesota that sponsors us also. We do write grants. And then like the president alluded earlier, when we inaugurated SLNA 2018, we happened to raise funds. The members themselves do make donations, generous donations monthly towards the organization. We do write grants. Then we have our community volunteering to come to this event. They render services to us, setting up the hall. We also reach out to the cities around to give us venues where we host these events. You've had other speakers talk about having health fair that we host for our seniors in the community. This is made possible by the intervention of a lot of community members. So those are the resources we hope to bring to the community.
Already. Thank you. Thank you so very much for touching base and especially talking about the partnerships and all the people that have contributed to the success of this fair. Those of you who are wondering, he is the treasurer of the organization. So definitely we needed to bring in all of that important details. Thank you so very much. And of course, we have a few comments coming in. Emilia comes in again and says, excited about the fatherhood partnership. Our kids, especially boys, need positive role models. Thank you, indeed. And of course, we also have a comment coming in from Osman Kanu says, SLNA is the most active and thriving organizations within our community, making inroads in our lives, our homes, our kids, and especially our seniors in the area of health and wellness. Great job indeed. You can also keep your comments coming in and we are going to read them live here on the program. Of course, if somebody just joined, what are the main goals or outcomes that we aim to achieve through the Health Resource Fair? Madam Secretary, if, for example, we were just wondering, okay, so with this Health and Wellness Fair, that is the 5th of its kind, what are the main aim and outcomes that we're hoping to achieve?
Well, Mr. Collins, one of the main aims that we are focusing on is to enlighten the community about the resources SLNA provides, the resources that are available in our community for both adults, children, and for our seniors in the community as well. We also want to focus on the fact that SLNA, as Usman Kanu had just indicated, is showcases a lot of things that the community needs. We actually have advocated, we will advocate for our seniors or other taking them to their clinic appointments or have answering questions. So if anyone is out there in the community that has a question about what am I supposed to ask my physician regarding my condition, I have diabetes, what are the things am I supposed to ask about? I have this medication. We can teach them about the medications that they are taking. Obviously, we are not physicians, so we always have a disclaimer and say, do not change or do anything without talking to your physician first. So we want to promote education for not only the senior community, but also for our education. Sierra Leone community has a lot of youth that are on the borderline or questioning, what am I supposed to study? We are a good example of what the nursing field looks like. We have young girls, we have young men going into studying school or graduating from high school this year. My niece is one of them, and she's questioning, what am I supposed to study? I am on a platform that I can educate her and say, these are the benefits of being a nurse. This is, you will get satisfaction in seeing, like when we meet with our senior program, it is so, we have such a compassionate crowd. I'm honored to be part of that group because I see the joy in their eyes. So for me to bring my niece to one of our programs to volunteer, it's also a way to teach her, start apprenticeship programs in our community for the youth to understand healthcare. I mean, not everybody is made to be a nurse, but there's so many things that you can do in the healthcare field. You know, you can be a sterilization technician, you can be a nurse practitioner like Kumba, you can be anything you want. This is a country, you know, we said a land of milk and honey. So our goal is to ensure that our children benefit from that, from the resources, and our community benefits from the resources available as well.
All right. Thank you. Thank you so very much for touching base on what we're seeking to do as far as this resource fair is concerned. If you are watching and you also have any questions for the leadership of the SLNA, please, you are more than welcome to leave your comments or your question, and we'll definitely ask them at the right time. At this point, we'd like to know, are there any other resources or services that have not been mentioned so far that attendees can expect to actually find at the Health and Wellness Resource Fair? Are there any other things? Of course, the last time even there was resources from child care and other areas, and actually our daughter is taking advantage of one of them. So please, if there are other partnerships or partners coming on with any other resources, I can come to you, Mr. Vice President, or Nancy, or any of you, Madam President, as well.
Well, Sheku, I'm the Vice President. You see, essentially, most of the target audience, the majority of the target audience we have are immigrants. Mm-hmm. And unfortunately, fortunately, Minnesota has a lot of resources, healthcare resources. But unfortunately, a lot of the members of our community do not know about the existence of these resources.
True.
So it's not only vendors from organizations that we're bringing. We actually have collaboration in bringing actually the Minnesota Department of Health themselves. They will send representatives, very big, the ministries, human services will send representatives so that people will know that there are the availability of resources that are there. You can't believe that sometimes people don't have income and they have healthcare challenges, but because they lack income, they don't know that there are resources available to help low-income people. Mm-hmm. So it's only when they come to these activities like these fairs that they're able to interact with organizations that can help them, and they say, "Oh, this was available, and I was suffering." And especially, there are people go through a lot of emotional challenges in this country because of the stress of work, stress of paying bills, all these. There are always, this country has a lot of resources, and Minnesota has a lot of resources for people. So that is one way we bring in organizations for people to know that there is a way out. If you have difficulties, there's always a way out, especially when you're struggling with low income and then you feel that the world is against you. No. So this is an opportunity for us to come together and for to provide these things. But it's not only going to be that. There is a lot. There's going to be a fun. It's a fun event. There's going to be our people, as they say, as Kumba was saying, they bring in African attires. Then there will be food. A lot of food will be there, African food, and we always make sure it's a light place. We bring games for the kids, and we also bring music and entertainment. So it's an all around. It's a global view that we are looking, because healthcare is holistic. We just don't look at one thing. And especially again, people who are going through financial challenges, they are going to be organizations that are going to come and talk to you about how to manage your finances. So it's really going to be a good program. Like you saw the one we did on Friday, May 5th last year in Crystal. You were there and you saw what happened.
Indeed, indeed. Thank you so very much for throwing lights on what people can expect and, of course, other resources. Are there anything else that we may need to add, please?
I would
I-
like to use, I'm sorry, Kumba. I would like to use this opportunity to invite any nurses, anyone out there that wants to do to volunteer in our community, to please join the Sierra Leone Nurses Association. You do not have to be a nurse. You can come and help us help with transporting our seniors who don't have access to come to the meetings. We're looking for volunteers. We're looking for nurses. Like Mr. Hassan said, you do not have to be in the community of Sierra Leone community. We want to reach out to every single entity, whether it's an American, African American, African. Please join this. When one community is well, we are all well. So please
Indeed.
come and join us.
Indeed. Thank you. Thank you so very much. Madam President, were you also going to add anything?
Yes, I was going to add, in addition to what Sheku said, we do have a few organizations that I wanted to highlight as well. There's one it's a business actually in our community, Omolara Kitchen. It's like a restaurant or a food service that they provide. But last year when they came, they actually were providing education about food safety, food sanitation and food safety. So they're going to be here again this year to provide that information to our community. And I also have the tobacco campaign. It's a campaign that's going on for kids under 21 to prevent them from smoking. So it's good. It's trying to protect their lungs and also preventing kids younger than 21 to smoke. So it's a campaign that has been going on in the state of Minnesota for a while now. So they're gonna come and they're gonna provide information. We're also gonna have the HIV team, the West African HIV Task Force. They're working on providing information and education to the community to prevent HIV in our community. They do testing, they provide education, and when you test, you get a $25 gift card. And I also just wanted to add, we're going to be having door prizes as well. Last year, we gave Alexas, to people that won Alexas, and most of our vendors also gave gifts to, individuals. This year, for people that are going to the independent stands, a lucky person or two people, they'll get a chance to win $100 of the independence gift. That's two tickets, and it's equivalent to $100. Yeah. So, and then we also have Alexas to give, we have headphones to give, and we have lots of free prizes to give to the community. So please come and enjoy with us, come and eat with us, come and sit with us and laugh. Bring the whole family.
Indeed, bring the whole family. And I'm happy that indeed Beyond Health there's the entertainment part, there is the social part, there's the part about bringing community together, networking, and of course creating fun for everyone. Mr. Hassan, is there anything like you would like to add as far as this part of the conversation is concerned, about what people should expect, especially when they attend this fair coming up this Friday?
Well, like Kumba touched on the tobacco group, tobacco situation is one area that the Sierra Leone community has been focused on for quite a long time. We have a youth group that is actively involved in driving other youths and educating them to help them stay away from drugs in general, including tobacco and other stuff. So that is an ongoing event that is going in the community. It's open to youths. So whether you belong to the Sierra Leone community or not, people are welcome to attend that group as well. In terms of other resources, you have, like Kumba have already said, we're going to have fun at the event, and we're inviting everybody to the Sierra Leone Independence. It's not only going to stop with the fair on Friday. It's going to be from 4 to 8 p.m. Everyone is welcome to attend. We're going to have a lot of fun. There will be African music. We have a DJ ready for that, for the fun part of it. Food will be available, drinks will be available. We'll all be there to socialize. Our seniors will be there. Prayers will be offered. We have pastors, imams. So the community is a diverse one.
Indeed.
You won't miss any.
Indeed. Wow. Thank you. Thank you so very much. I'm excited to know that indeed we are looking at the holistic approach to health, which has to do with well-being, emotional well-being, community, and of course, everything about it, and health as in general. So there's a comment also that I would like to read. Sata Kanu says, I attend the SLNA Health and Wellness Fair every year. And as a youth in this community, it's such an education opportunity to learn about how to take care of yourself and others around you. Indeed. Thank you so very much for that comment. And of course, Osman Kanu comes in again and says, SLNA plays a virtual middleman role in the dissemination of information, not just health related, but information like childcare, food drives, medical drives for vaccines, housing, smoking, drugs, and more. Indeed, a smoking part was even the one I'm also excited about, that we are very much intentional about educating the community, especially the youth, to avoid the process of even starting it. So that I think prevention, they say, is better than cure. And I'm happy that this fair is seeking to do just that. We're going to take just a quick break. When we come back, we'll be taking concluding remarks from all of you. So please stick and stay with us. If you have any questions as you are watching as well, please keep them coming in, and we'll get them in at the end till of this program. I will be right back.
We're teaching them about. You can come there and learn about money market.
Thank you for staying and
But with these skills, if you are finding yourself
touch with the Sierra
All right, welcome back to Africa Let's Talk. We have been talking about the upcoming Sierra Leone Nurses Association of Minnesota Health and Wellness Fair that is coming up this Friday. So it's only about 2 days away, and I know excitement is building up in our community for this health and wellness fair. I've been speaking to the leadership of the organization. So please, if you joined us, you are also more than welcome to leave your questions as we delve into this conversation. Of course, at this point, I'd like to take the concluding remarks from each and every one of you. And if there's also something that we left out as far as this conversation is concerned, please feel free to actually mention that. Of course, I'd like to begin with you, Madam Hussanatu Kamara. Please, if you can give us your concluding remarks, and if there's anything else that we missed.
We're inviting everyone in the community, whether you're from Sierra Leone or not, please come and join the wellness fair. You'll be entertained. You will learn about conditions that affect us in our community. You will promote education. You will see education for your children. Your children will have fun, and so will the grandmas and grandpas. So please come all, and let's have fun.
Indeed, come all and let's have fun. We are just be flashing some pictures so that people get to know, at least have an idea of how it is and what to expect when they come this year. Please, I'd like to take your comment as well, Mr. Sheku Sheriff or Alhaji
Well,
Sheriff.
another thing that we have to do that day that we'll be doing will be healthcare screening. As people come in, we screen them, check their blood pressure, and any other thing. See, the thing is, last time we went to Mounts View funeral, the cemetery there in Brooklyn Park. And on the right, a lot of the Africans are buried around that area. I was just wondering, I was just looking, I saw that if you looked at it, you saw that a lot of the our population, most of the people die in their 50s, their 60s. And then you look at the general population here, it's like 70s, 80s, 90s. And I was just wondering what was the reason? The reason is, one of the primary reasons is that we don't screen, we don't do a lot of screening. So these are things that are very important, because most of these diseases, if they catch them early, they can treat them. But most of us, we wait until it's very late, or you feel sick before you go to the hospital. So an annual physical, these are things we will stress for us all. After 50, you must make sure you are checked. So those are the things we're going to talk about, light things and things that are very important to our health too.
No, it's very important you brought this up, because I have been very, very concerned about the rate at which people in our community, especially early 50s, are dying. And I think you nailed it right where it belongs, that we are not screening well enough. We are not learning more about health. And I'm excited to know that your organization is very dedicated to bring awareness and the need, because we can't keep losing our young ones, especially to things that are preventable. Thank you so very much again, Sheku Sheriff. Of course, Nancy, please, if you can give us your concluding remarks.
Yes, we're looking forward to seeing all of you. Bring the whole family. Come learn of different health issues that affect all of us. You will be entertained. It's a good time to learn when you're learning in a really relaxed environment. Bring your questions. And as we kick off the health fair, May is also Mental Health Awareness Month. It is shown that 1 out of 5 adults in America suffer from some type of mental health issues. There will be representative from mental health organizations at the fair. Come with your questions. Let's take the stigma of mental health. Let's talk about the things that bother us, and let's seek out help. There's tons of help, like all the nurses have said, but until you knock, the door is not going to be open. So May is Mental Health Month, whether it's depression, whether it's anxiety, whether it's just continuous worried about something that you feel like it's affecting your day to day. Bring your questions. Come ready to learn. Come ready to entertain. Your nurses will be there. We're looking forward to seeing all of you.
Indeed, we're looking forward to seeing all of you. Everyone, please, all roads are leading. And the venue for this year is the Brooklyn Park Community Activity Center.
Brooklyn
Or the
Center.
Brooklyn Center
Brooklyn Center. Okay,
on,
all right.
on Shingle Creek
Shingle Creek. Okay, Brooklyn Center
Parkway. Yeah.
activity, of
Center.
course. Yes, thank you so very much. I'm going to project the address so that people can reach. Mr. Hassan, can you also give us your concluding remarks and anything else that you would like to add?
I just want to take this opportunity to thank all the nurses in the community, especially our parent body, the Sierra Leone community in Minnesota. We are working collaboratively with that parent body, and through that parent body, we do serve food for our seniors. We were able to give out food to our seniors and people 55 years and older. And we really want to encourage those seniors that have still not registered with us to please try one way or the other to join us. This is an opportunity for you to socialize with other seniors in the community, people of your own age group, etc. So I just want to thank everybody. We look forward to seeing you all to have a fun on Friday. And don't forget, Saturday, we have the Independence Day celebration for Sierra Leone. Thank you.
Absolutely. Thank you so very much. I also look forward to the Independence Day celebration as well. Thank you so very much. Madam President, please, your concluding remarks and anything else that you would like to add.
Yes, I must add that the seniors will have a table, and there will be on their table will be information from the senior linkage, the Minnesota Aging Community. There'll be information on how to connect with the senior linkage in Minnesota. So if you need problems like with housing or any other issues that you need, as long as you're a senior, you'll be able to get information from them. So we'll have information on their table as well. But there is a saying that in the abundance of water, the fool is thirsty. It means that you can be in a place where you have so many resources, but if you don't know where to access that resource, then you're in the dark. And that's why Sierra Leone nurses, that's where we come in our community. We want to be the bridge for our community to be able to advocate for those resources and bring it to you. So we want to see you on Friday. Come on, bring the whole family on Friday. Like as my colleagues have said, there are lots of information, lots of fun activities planned for you, lots of prizes, and lots of laughter, music, food. So please come join us. It's the big celebration before the bigger celebration. We just want to wish our Sierra Leonean community a happy 63rd independence. And we hope that we can get more nurses to come on board. That way we can make this program even bigger. I want to thank you, Mr. Beyond, for hosting us today. And I also want to thank our audience for listening. Thank you.
All right, we cannot thank you enough, and you are very welcome indeed. Thank you very much, the leadership of the Sierra Leone Nurses Association of Minnesota, for coming on to talk about the upcoming events, to talk about what people can expect when they come there, and why this continues to be such an impactful part of our community activities. I truly appreciate all of you for coming on.
Thank you.
Thank you.
Thank you.
You are very welcome.
Thank you.
Thank you so very much. Of course, once again, I have been speaking with the leadership of the Sierra Leone Nurses Association of Minnesota. Like you heard it of yourself, the event is coming up this Friday. Indeed, all roads are leading to the Brooklyn Center Community Center at the Shingle Creek Parkway. So the address is right there, 6301 Shingle Creek Parkway, Brooklyn Center, Minnesota. The zip code is 55430. And remember, the time is 4 p.m. to 8 p.m. The good thing about this is that this is a family-oriented event. So you can go with the kids, you can go with grandma, you can go with grandpa, the husband, the wife. Please, for the whole family, let's all make our way to the annual Health and Wellness Fair, which is the 5th of its kind, happening in 2024 by the Sierra Leone Nurses Association. And the next day, like they said, is the Independence Day celebration. So please get ready to come and get all the resources, information you need. And then the next day, go out there and have fun, cheer on, and of course, entertain yourself and the family. My name again is Kofi Oppong. To everyone who joined us on this very important conversation, I say a very good evening to all the contributors and the people who kept the information coming in, and questions and comments and feedback. I say thank you to everyone. God bless you. Have a good night. And of course, let's see you this Friday at the Health and Wellness Fair. Have a good evening.
For teaching them about free. You can come there and learn about money market.